You mentioned the International Working Group. I think we've all seen that there have been huge advances in how we treat HIV in the developing world, and then many lives have been saved. But cancer is certainly a much more complicated issue. What are we doing in terms of cancer in the developing world and research?
Yeah, well, unfortunately, in much of the developing world, even kind of standard chemotherapy is difficult to administer. Not so much just because of the cost, but I think also because of the necessary supportive care that is necessary in order to prevent patients from becoming, let's say, neutropenic or anemic, and being able to treat the infections that occur as a result of therapy. So it's a much harder overall problem to deal with in that part of the world. And what we're struggling with is to try to find treatment approaches that are feasible, cost-effective, and effective from a tumor treatment standpoint that can be readily administered in country. And it may not necessarily be what we would do in the West. So what we're trying to do is integrate a lot of the work that's been done in antiretroviral therapy, all of the PEPFAR programs and other programs that are now bringing forward the antiviral therapies to integrate that with cancer treatment as well. And that's quite an effort.
Oh, I can imagine.
Yeah. Yeah, and it's different in different parts of the world. Yeah.
What parts of the world does the AMC currently have projects ongoing?
Well, it's a nascent effort, so we're starting out with just a few countries. Places in Africa, such as Uganda and Kenya, are where we're starting because some of our members actually have ties already to cancer HIV programs in those countries. We're also doing some work in India, in Chennai, and in Mumbai, and I have some connections with folks in Delhi. So we're starting to branch out in India as well. And then we have a program in Brazil that also kind of grew out of some work that one of our members had been doing with some of the basic scientists as well as clinicians in lymphoma work in Brazil. So we're starting there, and I think as time goes by, we'll be able to include more groups. At the moment, we're also developing a protocol in conjunction with the AIDS Clinical Trials Group. And this effort will be focused on Kaposi sarcoma, looking at what might be the most effective treatment for both early and late stage KS. And we know that in KS, as we've heard at this conference, that iris is a big problem.
Iris being?
Immune reconstitution syndrome, if you will. And what that basically is when you start antiretroviral therapy, you get inflammatory responses, and in Kaposi sarcoma, it can result in a flare or worsening of the KS. And that has been seen quite frequently now in places like Africa. So what the ACTG-AMC study is meant to demonstrate is whether, in fact, when you start antiretroviral therapy, by adding chemotherapy, that we may be able to kind of overcome this explosion of KS that we sometimes see in the early situation. And in the later situation, where chemotherapy would be indicated anyway, try to determine what the best treatment, the most effective treatment, the one that's most cost-effective and easiest to administer would be.
Well, and Kaposi sarcoma is unique in Africa in that it's not necessarily an AIDS-related disease there, correct?
That's correct. But unfortunately, it's seen in great frequency because of the AIDS epidemic in these countries. And so much of it, unfortunately, is still tied fairly closely to HIV. But you're absolutely correct. There are settings in which KS can develop in the absence of HIV, and the places where those were first described were, in fact, in Africa. Yeah.
So domestically, I think for U.S. patients who are interested in the research and perhaps accessing clinical trials, probably the best resource might be the clinicaltrials.gov website, which lists all clinical trials in the U.S., including HIV and the AMC trials. And that website is www.clinicaltrials.gov, and it lists all the trials on it. And we also have a website, and I guess what closing comments would you like to say to let people know about the work of the AMC?
Well, I would just like people to be aware that, in fact, there is a group that is focused on developing treatments for AIDS malignancies. And since this is becoming a bigger part of the AIDS epidemic, we need to continue our work in this area. So while we don't have a lot of sites in the U.S., we have 7 core sites and 25 total sites around the country participating in clinical trials. If you go to the AMC website, you can access those sites that are nearest to where you live.
Great. Well, thank you very much for taking the time to speak with us today.
My pleasure, and thank you for having me.